For a long time, parents have passed on leaving their children to be orphans who are either total or partial due to constant and continuous death and other related issues. Mfangano Island in Homabay County in Kenya. Being an island with many fishing beaches, it's prone to a unique lifestyle that contributes to high prevalence rate of teenage pregnancies and HIV/AIDS, which leads to many orphans. Mfangano has grown into a large center of more than 30,000 people, as popular to all fishing grounds. Interactions between the native and the outsiders always turn out to be detrimental to either of the groups. According to a recent data, Mfangano Island suffers 30% HIV and AIDS prevalence, which is one of the highest in the world. The truth is that when girls reach a certain age, mostly in class 7 and 8, they experience adolescence, a stage where life-defining moments occur. Girls start to look attractive, and men, in this case fishermen, begin to pursue them for sex. I sat down with one Jennifer, not her real name.
When I got pregnant, I was in Form 3. It was difficult for my mom because it was somehow disappointing for the villagers, even to me myself. So my mom was disappointed. Akasema she cannot take me back to school.
The fishermen take advantage of the poverty situation in Mfangano Island and use money for fishing to lure girls into sex. Without proper parental counsel or any sex-related enlightenment, most girls find it hard to resist enticement from the fishermen. But for Jennifer, it was a whole new script from a well-informed public servant.
So who impregnated?
It was a teacher. My teacher. Yeah. So when he realized that he had done this, he was somehow shocked because he was afraid of his job because he thought he was going to lose his job. So he said he is going to take care of the baby, so I can just give birth, and she was going to take care of the baby. But later, it's like he cheated. Up to now, I've never seen such a help from him.
Most of these girls are born in families full of inadequacies, and to worsen it all, these young girls are therefore left in the hands of nobody and end up growing ununiformed, neglected, confused, depleted, and bump into anything that comes their way, whether it's HIV and AIDS, pregnancy, or marriage. Just like Jennifer, she experienced firsthand demoralizing obstacles young girls encounter in Mfangano Island.
Yeah, it was an emergency because they found that the baby mtoto alilala vibaya, so angetoka. It could not be normal delivery. I was to go to the theater, so it was emergency. I was taken to Homabay via the boat. Yes.
So you for several hours you were in water. What was it? What time?
It was because it was a boat. It was
How long were you? Masaa mangapi kwa?
It was somehow like 3 hours, and I was there in Homabay.
For Jennifer, lack of a theater in Mfangano Island, just like other women, for emergency services means using Lake Victoria to save a life, a situation that so far has left women lifeless.
So far, I can remember 2. One occurred in May this year, and another one occurred in it was June 2021. Okay, what happened? The other one, which occurred in May this year, this lady has pressure in pregnancy. We call preeclampsia. So when this lady came here, and she could not be managed here because the pressure was too high, so she was referred to Mbita. And because of the waves, I think they delayed in the lake. Reaching Mbita, Even the Mbita people couldn't address it, so they referred the girl to Homabay. I think she died on the way to Homabay. And the other one came, but she was almost giving birth. And on coming here, on pushing, she died before being referred. So I think if we had a theater here, she could be helped immediately.
The isolated Suba and Luo communities of Mfangano Island on Lake Victoria in Western Kenya experience some of the highest maternal and neonatal mortality rates in East Africa. Sena Hospital has been elevated to a level 4 hospital.
In our facility, we offer services to the teenagers because in Homabay County, it is prone. There is out of HIV/AIDS and teenage pregnancy. Like in Mfangano Island, it is more of teenage pregnancy, early teenage pregnancy, which has been affecting the community. There are about 36. But those who have delivered, there are 15, those who are having the babies. Yeah. Cool?
That's this year.
Yeah, I'm talking of this year. Yes, you may find some are defined, but they are not pregnant, and some are pregnant.
A model of peer mentorship to girls in Homabay and Mfangano Island is one of the remedies to early pregnancies. Joab Akuno is a technical expert on youth and adolescents working to reduce the vice in Homabay County.
Part of what we do here is to ensure that, one, we identify cases of adolescent girls and young women who get pregnant at the earliest opportunity, so that, one, we reduce the complications that they are likely to go through, because we know that very young adolescents, girls and young women face a number of complications during birth and delivery, and of course even challenges for their children, with of course notably very high cases of maternal and child health risks. So when we looked at the island, we then did place a young girl called a peer mentor at the facility to be able to help all other girls who come to this facility, one, to understand how the healthcare system operates, because sometimes they don't know what services they need or how they can acquire those services. So that adolescent girl who is a peer mentor therefore works with them at every stage to ensure that they receive the necessary services, especially in terms of pregnancy screening, HIV screening, and gender-based violence screening. So we ensure that is done for the triple threats.
Okay, my name is Salome Makori.
I sat down with Salome Makori, a peer mentor who works to make sure the girls have reproductive health information.
As per now, we have a total of 376. In these 376, we have 13 girls who are HIV positive. This HIV positive, we have 2 of them are pregnant and 11 are lactating. The ANC, we have 106, and now the remaining are postnatal, those who have kids here.
So in total,
we have 376.
I wanted to find out how HIV-infected girls here accept to medication.
First, you must convince her and inform her that she will be taking these pills all of her life. And another thing, because once they become positive, they have that thought that, oh, my generation is ruined. Every child, everybody, maybe my husband will be positive in this era. So you must give this girl hope. This HIV positive will stop by you. It will not be transmitted to your child nor your husband if the husband is positive, but only if you take your drugs as specified or as directed by the doctor. So we tell them about adherence, taking their pills, and also caring for their children.
Dr. Kevin Osuri is the Chief Officer Health in Homabay County, and part of his priority was to make sure this island had a theatre ward to avoid more deaths among women with pregnancy complications.
Yeah, you know, like in Homabay, we are one of the counties with the highest burden of teenage pregnancies at about 33%. Top 3 in the country. And we are just behind Narok. And I can tell you we are doing poorly. It's to cure this malady, which has been there for a long time. It's not a single bullet magic solution. It requires a lot of players. It requires a multifaceted approach. It requires both county government, national government, and development partners. I think you've seen our development partners particularly supporting these girls. I think it's G-Power. Yeah. G-Power. There are many challenges faced in this island and in this region. I think obviously you've seen one among them is the high burden of teenage pregnancies, the high burden of young school dropouts, and generally poverty levels. Given its terrain, the other big serious issue is accessibility because of the inability to refer patients quite fast to the mainland and, getting further assistance in our county referral hospital. So we felt it necessary, together with the governor and the deputy governor, to have this facility fully operational. So we have posted here a medical doctor, a couple of nurses and specialists who will be able to take care of this community and basically this catchment area. It's quite huge.
While it is absolutely impossible to chase away fishermen or remove poverty, we can certainly protect our girls and nurture them into great women. Undeniably, there is a need for mentorship in the island like Jennifer.
So when I was coming to the hospital clinic, I met a peer mentor called Salome. I talked to her and she managed to talk to my mom, and my mom agreed to take me back to school. And now I'm in Form 4. I'm going to finish my education.
According to reports, the rate of teenage pregnancy and motherhood in Homabay County is almost twice the national average, which is 18%. Studies have revealed that 33% of girls aged 15 to 19 years in Homabay County are either mothers or expecting. Now, for the longest time, this has been the only route that women and girls who need emergency services, they have been using to get services from the mainland, that is Mbita hospital. But right now, they are going to be receiving these emergency services from the mainland, from the island, without thinking of using this route, that is the boat, to get the services. For Ebru TV, I'm Odee Francis.